Orca Deco. Think home, think Orca.
Now, the urgent demand for healthcare workers across the country to help in the fight against the spread of COVID-19 has exposed counties whose health sectors were in shambles. One such county is Kirinyaga, where hundreds of health workers were shown the door for agitating for better working conditions. Ironically, the same county finds itself at crossroads as far as hiring new doctors is concerned, with the lack of functional public service board forcing the national government to take over the exercise. Ibrahim Karanja spoke to doctors who were formerly employees of the county, willing to go back to work, but their desire to help remains unwelcomed.
Scholastica Riziki, whose name we have changed for her own safety, is a trained and qualified medical doctor with years of experience. She has been following the rise in coronavirus cases in the country, not from the hospitals where she ought to, but from her TV back at home. She is among the health service providers dismissed last year by the Kirinyaga County government for allegedly taking part in a strike that the employer termed illegal.
I was in hospital, admitted, when the strike happened. So for a month, when I was discharged, I was told since I was not at work that I would be considered I was on strike with the rest of the people.
Rose Njonjo, also not her real name, faced the same axe from Kirinyaga months earlier. An attempt to further her studies and add on to her medical expertise saw her get the sack.
Some of us never received actual dismissal letters. We just had the salary stopped.
Their frustrations, especially at a time when more doctors are required to help fight the spread of COVID-19, is evident. They can offer help, but they say they are helpless.
We all want to go back to work and help them and assist in this fight, because when somebody is overwhelmed as a health worker or as a doctor, they are likely to make errors.
It makes me feel bad because I went to school, I studied, I'm competent enough to help the people who are suffering, but we are at home.
Now more than ever, the two feel like their medical skills and passion for humanity slowly and unnoticeably goes to waste, even as their colleagues in health facilities curbing the spread of the virus decry of being overwhelmed due to understaffing. Kirinyaga County in particular has been in the news for lack of enough healthcare providers at this crucial time, with Governor Anne Mombi Waigoro insisting the county government must hire new doctors. The County Assembly, on the other hand, deliberately refused to pass names of nominees to the County Public Service Board who would have in turn embarked on the process of hiring new doctors, a tussle that has made the National Public Service Commission take over the exercise, advertising positions which Scholar and Rose consider as a raw deal.
We were under PNP, permanent and pensionable, but the offers that are coming up from the government are on contract basis. So the question that lingers in your mind is, are you going out there to risk your life just for a few months? Then after COVID is done, you're told to go back to where you came from.
Their stories could be tied to Kirinyaga, but are familiar ones with healthcare providers across the country. Many health facilities are currently understaffed, yet experienced workers were fired for one reason or the other way before the COVID-19 outbreak. And with most counties having advertised for positions on contractual basis, it remains to be seen how these special cases will be treated.